So what's a healthy diet? A healthy diet for hormonal control. We've talked about insulin, we've talked about estrogens, we've talked about menopausal symptoms. And in my book, Your Body in Balance, there's a lot more on thyroid function and others, but let me just skip to the chase. The most healthful diet includes 4 healthy food groups: fruits and grains and vegetables and legumes. That means beans, peas, lentils. You should also take vitamin B12. You need it for healthy nerves and healthy blood. This is not optional. You really do need vitamin B12. But starting this diet is not really automatic. And in our clinic here at Barnard Medical Center, where we're doing work via telemedicine from Washington, D.C., or we're seeing people in person in the clinic, if we were to just say, you ought to try a low-fat vegan diet, you're going to be great, come back and see me in 6 months, that's not going to work very well. Because if you just logically tell a person to do it, logic plays almost no role in human behavior. And if you've turned on the television, you know this is true. And in fact, if you ask, how did you decide what you're eating for breakfast this morning? You didn't think, well, I could use a certain amount of fiber in my diet and maybe a little bit of beta carotene. No, none of that happened. We ate things based on our culture. What our friends eat, what our family eats, what I grew up eating, or what I'm going to call noise, what I saw on television, or what I saw on display at the store. Maybe I'm addicted to something. That's the case. People are addicted to bacon and whatever. Okay, so if you're explaining to somebody what a healthy diet is, let me show you neurologically what's occurring in their brain while you are talking. You say to a patient or you say to a friend, this diet is incredible. My diabetes went away. This is amazing. Or my hot flashes are gone, or my pain is gone. I feel so good. When you say that, the ideatron, you remember the ideatron in the brain? That releases little ideas, which start percolating around in the brain. But then those ideas like, oh, I should do a plant-based diet. Oh, vegan diet sounds good. Probably good for the planet too. The ideas irritate the famiglia. Then the famiglia signals to the don't-do-atory gland to release endorphins. And that wipes out the whole idea. Okay. Now, neurologically, this may not be entirely accurate, but you have seen this phenomenon. For those of you who have said, I am following a vegan diet, maybe you'd like to follow it too. At first, the person opens their eyes and thinks, oh, that's a neat idea. But then suddenly they come back to it as the endorphins kick in. They say, oh, where do you get your protein? And that's the end of the discussion. Okay, so forget that. Here's how we do it. And logic is not required. For every patient who we work with in the Barnard Medical Center or people in our research studies, here's the 2-step technique to adopting as close to a perfect diet as possible. I have never seen anyone unable to do it. Step 1, check out the possibilities. Take a week, 7 days. And during this 7-day period, your job is not to start a diet. You're not throwing anything out. You're eating what you want to eat. But what we are doing is checking out the possibilities. What would I eat if I were following a plant-based diet? I'm going to make a list. I got 7 days to make my list. Take a piece of paper, write breakfast, lunch, dinner, snack. Give yourself some room. Because between now and a week from today, I want to see that list start to grow. And you and I are going to talk again a week from now. This is the way we always do this. Okay, works great. So, all right, let's see now. Vegan diet for breakfast? I don't know. Oh, wait a minute. Okay, I guess I could have oatmeal without cream on it. I could put some apples or bananas or berries or whatever. Pancakes seems indulgent, but I guess if there's no butter, that's all right. Instead of scrambling eggs, I could scramble tofu. I don't know. If you like it, it goes on the list. If you don't, it's not on the list. So the idea is to try it. So let's go to lunch. Veggie burger, maybe a veggie fajitas. I don't know. Okay. And then let's go to a restaurant. My favorite Italian restaurant. It's got spaghetti with meat sauce, but it's got spaghetti with a marinara sauce or arrabbiata sauce or some other kind of spicy tomato sauce. In fact, they also make a pizza, leave off the cheese or go 50-50. You have cheese on your half, none on my half. Okay, fair enough. And I can go to a Latin American restaurant. Go Mexican. They got bean burritos and beans and rice. Oh, okay, fair enough. That's not suffering. That's pretty good. Or, if we go Chinese, they've got 30 things on the menu that are vegan already. They got rice dishes and vegetable dishes and tofu dishes, never had meat in them. Fair enough. Or let's go to the sushi bar. Start with edamame. Start with a seaweed salad, miso soup. And when my sushi arrives, it's not fish sushi. It's a cucumber roll or an asparagus roll or a sweet potato roll. All right, cool. Oh, no. I don't eat any of those places. I eat at Taco Bell. Or I'm going to Subway. This may not be the pinnacle of culinary art, but they've got something for you too. Bean burrito, hold the cheese. Okay, that's a passable choice. Fair enough. All right. 7 days have gone by. I got my list. I got all kinds of things. I was kind of surprised at all the things out there for me to eat. All right. You've done very well. You completed step 1. That was simple. Step 2, 3-week test drive. During the next 3 weeks, we're going to do all vegan all the time. That's it? Just do vegan for 3 weeks? That's it. It's really easy because, first of all, you can do anything for 3 weeks. And secondly, you've already got your list. You figured out the foods you like. You probably stocked up. Okay, let's jump in. At the end of this period of time, 2 things will have happened. 3 weeks later, you've lost some weight. I wasn't really trying, but look at the scale. It's smiling right up from my toes. That's amazing. And if you've got diabetes, your blood sugar is improving. By the way, if you have diabetes, run, do not walk to a low-fat vegan diet. It will change your life. But because the blood sugar lowering effect is so rapid for many people, talk to your doctor first. Anybody on medication, talk to your doctor first, because the combination of the strong medicines you're taking, let's say you're taking insulin now and you're going vegan, your blood sugar can go, you can become hypoglycemic. So let your doctor know and say, I want you, doctor, to work with me to reduce my medications if and when the time is right. Okay. So you don't throw your medicines in the trash. Don't disregard your doctor's advice. This is a partnership, and you work with your doctor. Same if you're taking blood pressure medicines. If you're on a diet that lowers your blood pressure and medicines that are lowering your blood pressure, you don't want to have your blood pressure go too low. You stand up from sitting at the table and you get lightheaded. Okay. Let your doctor know you're doing this, okay? Because this is a powerful diet. My point is, within 3 weeks, you won't feel all the benefits, but it will start. If it's menopausal symptoms you have, some people get benefits in the first week, but for most, it's probably 4, 5, 6 weeks into it. One thing you don't have to give up, you never have to give up skepticism. If you're thinking, I'm not sure I trust this diet, fair enough. Give it a try. The science is there. You don't have to believe in tetracycline. If you got an infection, you just take it. So you try the vegan diet, see how it works for you. The other thing is, don't burden yourself with long-term thinking. I don't know if I could be vegan forever. I know what you're thinking. You're addicted to cheese. Okay, you are not alone. But don't think long-term. Focus on the short term. Don't worry about what you're going to have 20 years from now. Just think, let me see if I can get cured now. This is why I always encourage people. Some people will say, is this all or nothing? How about if I do kind of semi-vegan diet, or I can maybe have a cheat day on the weekend or whatever? I would suggest setting that idea aside for now. If you've got a medical condition, let's focus on curing you now. Let's do the diet as prescribed. Let's treat the diet like a drug that you take as prescribed. And after a while, once you feel well, if you decide, I want to bring that junk back into my diet, okay, you can anytime, but let's cure you now. See what I mean? Okay, so we've got lots of resources for you. We have an app, free, the 21-day vegan kickstart. If you go on your iPhone or you go in your Android, you'll see it there. Go online. It's in English. It's in Spanish. It's got menus and recipes and cooking videos. It's fun. We'll walk you through day by day what you can do. 21-day vegan kickstart. And this is you can shoot this, get out your phone. You might even shoot this right now if you want to. This QR code goes to the website you see written there, foodinstructions.org. And at foodinstructions.org, what we have is little videos about the things I've explained to you. This is especially for diabetes. Insulin resistance is kind of a complicated topic, so we've made it really simple with funny little cartoon videos that we give to every patient who is on their way out from Barnard Medical Center. So foodinstructions.org has it for you. And it's fun, and it's a good way to communicate with friends who aren't yet participating in this program. The last thing that I just want to say is a big thank you. I really appreciate, first of all, the organizers. Thank you for bringing this life-saving information to so many people just year after year. I'm very grateful to you. Thank you for including me. But more than anything, I want to say a word of thanks to those of you who are participants. If you're participating in this and you've heard a message you can share it with other people. You know, if you bring home a prescription for metformin for diabetes, I know what you're not going to do. You're not sharing that with anybody. You don't walk in the front door and say, hey, honey, I just got some metformin at the clinic. Do you want to try some? No, you don't do, you can't share medicines. But if you learned about a diet change and how foods can change how you feel physically, if they can restore your health, you can share that information with everybody and they can all use it. And if you're making my vegan lasagna, maybe they can jump in there too. You'll never know if when you post this on Facebook and you tell people, do you know what I learned today? Give them the link to this program. Let's spread the word together. If you do that, you're never going to know whose life you've saved, whose life you've changed. But I guarantee you, it's lots of people. That's our work. We do the research. It's not easy, but we've got to be careful. We've got to make sure we're right. But then once we know what's right, for diabetes, for cancer, for pain, for any condition that's harming a person's life, we need to get the word out there.